Gary Almeida, status post-heart transplant, increasing shortness of breath.
She's got a congenital heart defect. Had 4 heart surgeries and a transplant last year.
But they have her file. You can read everything.
Hey, Dr. Reynolds.
Madeline, what happened?
Kiri can't breathe.
Oh, Kier, I thought we agreed. No more emergencies.
Let's type and cross.
Well, she's AB. Kiri's been my patient since she was born.
Could she be rejecting the heart?
I have to do a biopsy.
But could she?
Yes. The question is how badly. Book an OR and page Dr. Sharp for a biopsy.
She's had so many risky surgeries.
Yeah, it's all standard protocol.
I know, but for a child.
Extracting a heart sample now.
Negative for Arvid.
Prepare to withdraw the catheter.
Yes, Dr. Reynolds. Heart holding steady at 75 BPM.
What's the severity of the rejection? It's 2R, 3R?
Oxat 95. Dopamine and vasopressin all 4.
0.
0.
There's no evidence that she's rejecting the heart.
And what the hell's causing their symptoms? Well, Kiri's chest X-ray and CT scans aren't what I hoped for. Her lungs seem to be failing.
Why?
I don't know yet, but we started her on a cocktail of antibiotics to help fight infection.
At least she's not rejecting the heart.
That's your takeaway?
She's trying to find something to hold on to.
Kiri.
Sorry. It's okay, baby.
Oh, Floyd?
Kiri, does this hurt? Okay, just relax.
It's okay. What's happening?
Her liver is failing as well.
First her lungs, then her liver, now her kidneys.
Yeah, I don't want to put Kiri through any more operations, but that may be our only option.
Would she at least be on the top of the transplant list?
How many more surgeries can she take?
What if you want to do nothing?
Okay, guys, can we go outside?
I just want to make a plan.
And I don't want her to be in any more pain.
Our daughter is going to die, Ted.
Guys. The only thing that's going to get you through this again is each other.
We're separated. 5 months now.
Ironic, isn't it? The first minute that Kiri doesn't have any problems, we find out that we do.
Excuse me. Sorry. Dr. Reynolds, can I have a word, please?
Please tell me you have good news.
Our request to put Kiri on the transplant list has been rejected. With multiple organ failures, they don't see her as a viable candidate. How are they holding up?
They're not. We've been through so much together. I mean, I really thought nothing could break them. They had the perfect family.
There's no such thing.
Where are we?
She's in respiratory arrest.
O2 stats are down to 84.
I'm gonna intubate.
Prepping intubation kit now.
Oh, baby. I don't know what's happening. Your body's not rejecting your heart.
No, just everything else. Floyd? Her blood type. You said it was AB.
Guys, think back to 4 or 5 weeks ago. Did Kiri get sick or...
I don't think so.
You know, she had that stomachache about a month ago, but it wasn't...
Lisa, get me tacrolimus and methotrexate.
What's happening?
Hopefully, Kiri's more extraordinary than I thought. Okay, what do you see?
Okay. It looks like she had E. coli, but this complication is so rare.
But
We were right. Her blood type's changed.
she's not AB anymore.
Nope, she is type O. Same as her new heart.
Which explains why her body's rejecting everything but the heart. So if I bombard her with immunosuppressants...
Go take care of our girl.
Hey! Natalie!
Hi.
We thought we lost you for good.
Why? It was just a little sabbatical.
We didn't hear from you for 3 months.
I'm sorry, I should have called. I just got caught up with family stuff.
Dr. Halstead, look who decided to come back.
Hey, Nat.
Hey.
Good to see you.
You too.
Uh-oh. You're gonna have to catch up later. Incoming.
Welcome home.
Brian Cutler, early 40s, high-speed crash, prolonged extrication, unresponsive, unable to intubate.
You're going to trauma 3.
GCS 5, heart rate 78, BP's 120 over palp. His wife is right behind us.
Natalie, take the husband.
Doris, no, with me.
Yep.
Brian. Judith Cutler, GCS 15, vital.
Brian.
I'll sign on her right now.
Go to trauma 1.
It's okay. He's being treated. I'm Dr. Halstead. I'm going to take good care of him.
Monique, let's go.
On my count, 1, 2, 3. All right, Doris, take over bagging. I need to intubate. 100 of sucks, 20 of etomidate. Fasten, Dr. Sexton.
Yes, ma'am.
And also, I need a chest x-ray.
Yes, doctor. Flying it.
We were fighting. He didn't see the other car.
Mrs. Cutler, are you always this horse?
What? No.
She's got seatbelt sign. Chest wall tenderness. Hey, I want a 4-vessel CT angiogram with laryngeal cuts and a CTC spine, chest, abdomen, pelvis.
Right.
Help, Brian. Things I said, I didn't mean to have to tell him. I'm sorry.
Don't worry, we're taking good care of him. You'll see him soon. Pass is clear.
I'm in. Chest is clear. All right, let's send him up to CT for a pan scan.
I have to tell him.
Okay, good news. Abdomen and pelvis scans were clean. Your laryngeal CT did indicate some mild swelling, but your arteries look good. No damage to the major vessels.
Hi. Mrs. Cutler, I'm Dr. Manning. I've been treating your husband, Brian.
Can I see him?
He's still unconscious. The pan scan showed his spine, chest, and belly were clear. However, his head CT showed diffuse bilateral intraparenchymal bleeding. I'm afraid we're talking about a bleed in the brain.
Oh, God.
This is not something we can resolve surgically, so we've taken your husband to the ICU. The hope is that we can control the bleeding and the pressure enough so that he will wake up.
He has to. Please, I have to tell him I'm sorry. I said such horrible things.
Mrs. Cutler, since you're still hoarse, I've just paged the ENT to scope your larynx just to make sure there's no damage to your vocal cords. As soon as we do that, we're going to take you up to see your husband.
Thank you. Thank you.
What was that all about? Tell him she's sorry?
Yeah, they were having a fight when the accident occurred. She's afraid she won't get the chance to tell him how she really feels.
Intracranial pressure is way up.
Henry 5 of morphine.
BP spiking.
Heart rate's down to 42.
Cushing's response.
Give him another 70 of mannitol.
Will, his pupils are blown.
Veronica, turn up the vent and hyperventilate him.
Will, we've lost him.
Damn it.
We maxed out on his meds. There was nothing we could do.
I know.
Dr. Manning.
Yeah.
I understand you just lost a patient to an intraparenchymal bleed.
Yes, Brian Cutler.
And we're about to inform his wife.
Well, there's something I need you to ask her.
Can I go see my husband now?
Mrs. Cutler, I'm afraid we have some very bad news.
Your husband.
Oh, my God.
We were unable to control the bleeding in his brain. He suffered what we call herniation.
That's when pressure on the brain cuts off blood supply.
Brian is...
He's brain dead. Unfortunately, it's irreversible.
Oh, no.
We're very sorry.
I never told him.
Mrs. Cutler, we know this is a terrible time for you, but we need to ask. Your husband was not registered as an organ donor.
This can't be happening.
There's a young man in this hospital who needs your husband's heart, but we need your consent.
Mrs. Cutler, your husband's heart will save this young man's life, and the sooner we act, the better. May we have your permission? Thank you.
Thank you. Miss Cutler, the transplant was successful. The young man, the recipient of your husband's heart, he's doing well.
The last thing Brian heard me say was that I didn't love him. May I see him? The young man?
The heart recipient?
Yes. Please. Closer, please. I'm so sorry, Brian. I love you.
I was getting ready for work. I went into his room to kiss him goodbye. He wasn't breathing. And his heart stopped in the ambulance.
I need to confer with Dr. Shane. I'll be right back, Rafe.
I heard they brought him in.
His brain was deprived of oxygen for too long. He's not coming out of this.
I'm surprised they resuscitated him. A case like that should be a DNO. Why is he on a ventilator?
I made him a promise.
I'm scared of the dark.
Oh, I'm sorry. I'll turn it back on.
No, I mean, the dark. I want my heart to go to somebody and keep beating. It just won't seem so scary that way. Can you do that?
Colin, you have a very special heart. It might not be easy to find a place for it.
I know what HIV positive means. Couldn't you find someone who's like me?
It's not that easy. And it's not just that. Even though we fixed your heart, you had
congenital heart disease.
You're a smarty pants. They don't really let us give those kind of hearts away.
Yeah, but you're a smarty too. I bet you could figure something out.
Maybe.
Do you promise?
Promise.
You think you'll be able to keep your promise?
I don't know.
HIV positive heart with a history of heart disease. That's too many strikes against you.
We're not giving up. Lynn, call AIDS United. See if there's a policy rep who's familiar with outreach to local clinics. Oh, and Ji-sung, check the university database for any studies with HIV and congenital heart defects.
Got it. I'm on it.
We found 5 recipients and no viable recipients. Will you let us know if anything changes? Thank you.
Hey, got your text. Where are we?
Private wards. Dr. Shane thinks he's found a recipient for Colin's heart.
Here.
Yeah.
So I just checked her in. Hey, Chris. Hey, Nima. So this is Nima. Hey, baby girl. She's dying of heart disease. And she's the perfect match for Colin's heart. Aren't you?
That's a chimpanzee.
Yeah.
Jesse, how did you get a chimpanzee?
I volunteer at the local animal sanctuary. The vet who runs the place is an old friend. She asked me to come in for a consult. And Nima has dilated cardiomyopathy.
You want to put my boy's heart into a chimp?
Yeah.
There has never been a human-to-animal heart transplant.
No, this should be the first. But blazing new trails is your speciality. Chimpanzee physiology is amazingly similar to humans. And Nima is Colin's size and weight. His heart could save her life.
What about HIV transmission?
Well, the virus can replicate inside her, but infected chimps have rarely been known to develop the clinical symptoms of AIDS.
Cross-species heart transplant. What about a metabolic state? What if there's immunologic rejection? And
I know someone who can help.
No. No way in hell. An animal, no.
Rafe, I know it's a big leap, but we can't find a human candidate.
Still no.
What about Colin? Didn't he love animals? What would he say?
You know what? You don't need to make a decision now. I'm not even sure if this is possible. We need to find out.
Hang in there, sweetheart.
Are you out of your bloody mind? No. Sorry, let me rephrase that. Are you both out of your bloody minds?
We already have the surgical infrastructure for this procedure. We also have the collaboration of a highly skilled veterinarian.
We can turn xenotransplantation from a surgical research tool into a solution for the worldwide organ shortage.
Who knows where the collaboration between doctors and vets could lead? At Colorado State, finding ways to save limbs in dogs has already led to the treatment of teens with bone cancer.
Stop. It's not going to happen. Do you have any idea how damaging this would be to our reputation, to our funding?
Tell me this isn't about the board review coming up.
Let me be clear. St. Matthews is not in the Zubiquity business. We are in the human healthcare business. And I will not sacrifice precious resources because you made an impossible promise to a little boy.
Fine. Well, I'm not giving up yet. I'm gonna go check with the AIDS Foundation.
Thank you.
I just don't think you get it. So I'm gonna try again because I want you on our side. But the truth is, I made a call to the board of directors before I came here. I'm sorry, Millie, but I'm gonna pull rank.
The hell you
Surgery's
are.
my jurisdiction. This is my call to make.
Jesse, I'm trying to protect you. Have you considered even for 1 minute what would happen if the surgery failed?
I was hoping to convince you to do this, but they're not gonna let us do it.
It's time for this to be over.
Hey, little buddy. You were never supposed to make it this far. When I pulled you out of that dumpster, I had no idea that you'd be such a world-class fighter. But you don't gotta fight anymore.
I want to take him off the ventilator.
No, wait, stop. We're doing this.
Because of the chest wall's proximity to the aorta, you should use a striker saw.
Wait. I wasn't aware sanctuaries tattooed their animals, but medical research facilities do. Where did you get this chimp from, Dr. Shane?
Not now. We have a patient on the table.
There's a registry. All I have to do is run the number and I'll know. So, last chance. Where's Nima from? Where's Nima from?
Millicent, please. This is Colin's heart.
Is this animal stolen property?
No one should have the right to call life property.
Shut it down.
Millicent, you can't.
As chief of surgery, you have the power to overrule me on this operation. But if this chimpanzee is stolen, then as chief operating officer, it is my duty to stop an illegal procedure. No personal
Just turn
crusade is
off
worth
the
destroying
PA.
St. Matthews. Proceeding with this operation would be a criminal action. Everybody stop what you're doing right now. Shut it down.
Do you realize how many human lives have been saved because of Nima?
Do you understand what happens to a hospital once its accreditation has been revoked?
Scalpel.
Yes, doctor.
Don't you dare.
This heart. This life-giving heart. You want me to throw it out?
Alex, so help me.
This breathing life. You want me to let it die? Because if you shut down this surgery, both those things will happen.
I'm trying to save an entire hospital and everyone who works in it, Alex, not just your patient.
Blood pressure dropping.
Alex.
I've made an incision. The operation has begun.
We're obligated to proceed.
Cautery. Okay, start coming down slowly.
Coming down.
Run a full trauma panel.
What the hell happened?
The Santa Ana's semi versus this lady. The other driver said the wind pushed him into her lane.
Please, not the heart. Not the heart. Not the heart.
Sluggish reactions. Possible subdural hematoma.
Yeah, I want eyes on that brain bleed.
She didn't beat them.
Charge paddles.
Wait.
She's situs inversus. Her organs are reversed. She was a patient of ours 10 years ago.
Clear!
Need a gram of Solumedrol.
Okay, we've got a contusion on the left temporal lobe with considerable bleeding.
Leo's on his way.
What, do we pull him away from his golf game?
Please don't die.
She has the heart of a man half her age. It'll fight.
We've got to decompress his cranial bleed before she crashes again. She's bradycardic, her pulse pressure's widening. After what we went through to give her a new heart, we can't let her die to TBI.
You're damn right she's not. I'll relieve depression myself. This heart has to live.
We've done everything we can. Let's call it.
Push another round of steroids.
Your patient is brain dead, Dr. Pantier. She's not coming out of the coma.
Coward.
You want to take her off life support?
She wants you to say bye-bye.
Look at the contraction of the atria. The beautiful peak, the perfect sinus rhythm.
There's no next of kin.
I'll take her off life support.
No. It's a young heart.
I'm not following.
I am.
We keep her on life support. A regift.
Harvest a transplant.
You want to transplant this heart into someone else?
This heart is a 1 in 10,000 miracle.
We could cath her. Make sure the coroners are
A
clean.
biopsy would rule out any trace of rejection.
You want to retransplant this heart? Oh, God, they're both on board. Okay. Okay, so am I. Okay, we don't have much time to see if there's even another living soul out there who needs a heart like this.
Then we start looking.
10 years ago, Joy Tanner was our patient. She's 56 years old. She was a world-renowned archaeologist. This morning, Joy succumbed to head trauma from an MVA.
Joy was born with her internal organs inverted. If this tissue biopsy confirms that there is no rejection, we'll be able to regift her heart to another recipient. Pass it around.
See the tiny little red part down the bottom? Now, on her license, people. Organ donor.
Those 2 words are her explicit wishes to live on through the most generous gift anyone can give. So, today we're gonna honor Joy Tanner's wishes.
There's a patient in Lancaster dying of congestive heart failure. His heart's also on the wrong side of his chest.
He needs a miracle, and she has it.
Now, Dr. Silvano's already flown out to evaluate the potential recipient and bring him back.
Now, put your hands in the air if you're a designated organ donor. If your hand's in the air, scrub in. You're about to participate in a dextrocardiac retransplantation. The rest of you, please go down to the utility room. There are bedpans to be washed.
The heart's a bag of blood, barely beating. She wouldn't have survived another day. And we'll go on bypass, please. Now, take a good look. Probably never going to see one of these again. Note the inverse...
Dr. Shane, you have to stop immediately.
What?
The family decided not to donate. That heart, it's not for you to transplant.
The patient's old heart is in pieces on that tray. So either you let me do this, or you can sign my patient's death certificate. But don't worry, I'll make the decision for you. Sutra. Look at the stitching. Fancy, you're an artist.
I had a good teacher.
So I expected more scar tissue.
This is a heart that does not want to give up. Marty, the heart box. One-of-a-kind heart deserves a one-of-a-kind delivery. Meet Lazarus.
Lazarus will perfuse Joy's heart, keep it beating all the way to Lancaster.
Helicopter ready?
There is no helicopter, doctors.
What?
The wind. Everything's grounded. Nothing's coming in or going out.
Finally, you guys. Here's his chart. Come on. This is Mr. Gonzalez and his daughter, Gloria.
Hi, Mr. Gonzalez. I'm Dr. Pantier. This is Dr. Shane, and this is your new heart.
Hello, mate. We're going to have to get you prepped for surgery. Cardiac index is hovering around 1.8.
Okay.
Where's that bypass machine?
What? They're stuck in traffic. The wind is down
We
some
don't have
trees.
a bypass machine.
What? Wait, what does that mean, this machine?
We need it to circulate your father's blood and oxygen during the transplant.
Otherwise?
We can't do the procedure.
So what are you going to do?
Gloria, don't be rude.
This hospital is so outdated.
Wait, I want to know what you're going to do to save my father's life.
That's what we're trying to figure out.
It's like we're back in time.
What happens if the machine doesn't come soon enough?
Gloria, they will do what they can.
Dad, I'm asking the questions. You're being the patient. What happens if this machine doesn't come in time?
Nothing. We don't need it. First heart surgeons didn't have bypass machines. What's your blood type?
O positive.
Same as your father? Same as the heart. Little high procedure.
If we don't have a heart and lung machine, we'll make one. Out of you.
What could happen to her?
With any major surgery, the procedure carries risks. She could lose circulation to her extremities, develop shock.
Die.
There's always a risk. It's highly unlikely your daughter will die, Mr. Gonzalez, but if we don't try this, you will.
This is not what I need. An instruction manual for life without you. I need you to pick up the phone when I call you from college. I need you to be there for me when I'm having a bad day.
I need you to live. I'm an adult. I'm 18 years old. I make my own decisions.
I'm 55. I'm an old man. And I decide what I want to do. And I want to leave now.
Well, she's prepared to take that risk.
Do you have children, doctor? If you were in my place, what would you do? She's all I've got left. I could never forgive myself, if anything, for...
Let's move, people. Looking good.
Holding steady. Flow's good. Ready to proceed.
Her heart is beating for his. We are looking at the very foundations of open heart surgery, my friends.
Her lips are turning blue.
She's malperfusing.
Her father's getting the bulk of the blood.
Okay, let's readjust the flow.
Clamp.
Just enough to restrict Louise's flow.
Gloria's pressure should rise.
Yep, I got a tibial pulse. She's pinking up.
Mr. Gonzalez is back in range, holding steady. Okay, let's rock. I'm gonna pass out.
The hell you will.
Whew. Okay, scalpel.
Scalpel.
I ended up disimpacting Gomers and plating sputum for 6 months because of you.
I almost lost a friend because of you.
But you didn't. Thank you, Joy. No one ever told me who convinced that family to sign the donation papers, but whoever it was, thank you. Without you, I wouldn't be here to save this heart and this life.
Amen.
Amen.